So I think the question of whether or not T-DXd is an appropriate and effective option in the frontline setting is really quite relevant, both from the perspective of improving efficacy, but also from the perspective of potentially shifting the toxicity profile to be more manageable.
Sure.
So certainly in DESTINY-Breast09, that essentially is what we did see. This was a frontline study comparing Cleopatra to T-DXd. And we saw a significant improvement in progression-free survival in patients who were randomized to the T-DXd arm versus the Cleopatra arm. And as you said, this really represents the first data set demonstrating a significant improvement over the taxane HP regimen.
Now, it was actually T-DXd plus pertuzumab, and then there was a third arm of T-DXd alone, which has not yet been reported.
Yes, thank you for clarifying. I should mention that we saw data for the combination of T-DXd plus pertuzumab. You know, I think we're awaiting that T-DXd monotherapy data, but certainly T-DXd
is to be reported in the the final data suite for the IDFS endpoint.
Yes,
I understand, or I'm sorry, PFS endpoint. Primary endpoint.
Yeah.
When that becomes mature. Well, that's great. So it sounds as if we're enthusiastic about T-DXd in the first line with pertuzumab in this case.